Deputy Speaker. I too rise today to speak on the motion raised by the member for Fisher, and in doing so I acknowledge the bipartisan support in making sure that long-term mental health reform continues to be a national priority. Deputy Speaker, mental health continues to be a crucial area that needs our attention because, despite continued efforts of funding and reform in this area, mental health remains a significant health issue for our community. So I do acknowledge the government for maintaining mental health as a priority, one that is a key pillar of the National Long-Term Health Plan with its $4.3 billion investment, and I want to acknowledge the commitment to providing more support service and increasing investment in national psychological support measures, including striking an agreement with the state governments that will ensure more support services for our community. Deputy Speaker, Madam Speaker, Labor has a strong and proud record in delivering long-term mental health reform. It's a record that I certainly do look forward to having the opportunity to see continue under a Shorten Labor Government. Now, in government, Labor increased funding for mental health by 357% to around $2.4 billion from 2011 to 2012 and to 2014 to 2015. Labor invested around $200 million over 5 years to fund an additional 30 headspace centres, bringing the total number of centres to 90 by 2016. I do remember well, Deputy Speaker, some 10 years ago when Professor Patrick McGorry made mental health a key national issue and not only began the conversation about an area of health that too often is neglected or ignored, but his passion and urgency ensured that mental health was a key government priority and secured significant funding agreements from both the government and the opposition at the time. The focus on youth mental health and suicide was of particular concern, and the many headspace centres that were established as a result of Professor McGorry's advocacy became the formula with which government responded to youth mental health. Now, one of these headspace centres, Deputy Speaker, is in my electorate in Craigieburn, and it provides an invaluable service to my young constituents. It's run by Orygen Youth Research Centre, and it caters for young people aged 12 to 25. It provides for them an opportunity to talk about their mental health in a safe space, provides support and advice on anything from worries about homework, drug and alcohol concerns, relationship pressures, family issues, and just generally experiencing tough times, as many young people do, and we know that from our own experiences. It is estimated that around 4 million Australians aged 16 to 85 experience mental health problems. 1 in 5 Australians, Deputy Speaker. That's a staggering statistic, and some of my colleagues have already spoken about their own personal experiences with mental health. Around 600,000 children and youth between the ages of 4 and 17 were affected by mental ill health, and tragically 2,866 Australians died from suicide in 2016. Recognising that we do need to do more, and in response to these alarming statistics, Labor put forward a mental health policy at the 2016 election with a strong focus on suicide prevention, which included adopting the National Health Commission's recommendations to reduce suicide by 50% over 10 years. The Turnbull government at the time was encouraged to adopt this policy, but they have yet to do so. So I do want to take this opportunity to not only congratulate the member for Fisher, but to also ask my colleagues in government to urge the government to adopt this policy as part of the continuing need for bipartisan support in this critical area of mental health. Now, as an electorate, Calwell has the highest intake, Deputy Speaker, of refugees from Iraq and Syria. These people come from war-torn countries who in their life have seen indescribable trauma and been exposed to conflict, violence and death. These new and emerging communities may not be aware of the mental health care plans because of language barriers and cultural differences, or in some instances they aren't entitled to a mental health care plan. So thankfully members of our community have rallied to their support. And an example of this is the youth-led grassroots support organisation called Colouring Clouds, which aims to raise awareness of mental health services and to encourage young people to talk to each other openly about their mental health without fear or judgement or stigmatisation. Co-founded by my Broadmeadows constituent Anthony Luca and his friend Seamus Carr, Colouring Clouds collaborates with local community groups to create targeted services for those in the electorate with a focus on the demographic of 25 years of age and under. So one of the activities they've undertaken is helping Banksia Gardens run an after-school sporting program at Bethel Primary School, where they use a fun and informal setting to talk to young kids about the importance of physical activity, self-care, caring for your friends, and being able to talk to people about your feelings without fear or shame.
I thank the member. The time